I am Nedra Kinerk, President of Futuro RGV, and I want to welcome Chief Victor Rodriguez, Chief of Police for the City of McAllen. And this is our Futuro RGV discussion on how COVID-19 is affecting McAllen and our Hidalgo County communities. But first, I do want to thank our sponsors, and they're one of the reasons that we can put on these presentations for our communities. And so this discussion and those of other Valley leaders are on the Futuro RGV Facebook page and YouTube and social media for further viewing. So this will be a part of that. And Futuro RGV moderator, Felipe Salinas, will discuss with Chief Victor Rodriguez what we might expect and where we may be going with this pandemic on public safety and anything else that Chief Victor feels would be helpful for you to know. So now, Felipe, I will turn this over to you and Chief Victor to help us understand the COVID-19 challenges we face in the months ahead, what we are doing right or wrong, and what to expect in the months ahead. Felipe?
Great. Thank you so much, Nedra. Welcome, Chief. Good to see you.
Good morning. Likewise. Thank you so much for having me.
Great. So, Chief Rodriguez, I guess the first thing I wanted to, as Nedra mentioned, the series that Futuro RGV has been doing has been focused on the pandemic, what we have learned or what we're learning through this experience, what we can kind of take away from this as we go forward. So I thought maybe we could just go back a little bit, and if you could maybe give us a bit of an inside look into how the McAllen Police Department has responded to the pandemic, maybe first by telling us a little bit about the kinds of ways that you and your officers had to change how you carry out your role and fulfill your duties in the day-to-day in the midst of all this.
Well, I think that the most important thing that that struck us about the pandemic is the realization that we could possibly be infected, and that that combined with the fact that the need for police services doesn't go away because of a crisis. So we had to kind of balance and begin to, our biggest task was to develop contingency plans for staffing, because our calls for service would require, we're not some of these public services that can work from home. We're not some of these things that we can, put off until, later. The need for police services, and it's critical to every community, must be reliable. And our police services have to be there. We have to answer the calls. Life and property hang in the balance. So we at McAllen, for example, on the average, we go somewhere. What I mean by that is we answer a call for service every 3.5 minutes or so. That doesn't go away. It hasn't gone away. It might have slowed down a bit in at some critical periods along the pandemic, but it doesn't go away. So our biggest challenge was to contemplate and to plan and to develop contingencies for the possibility of this contagion affecting our personnel. If one person's out and he or she's out for 14 days plus, then how do we fill that void? And what if you have a series or a whole shift affected by that? So our biggest task was at the beginning, and we like every other agency around, we had our share of employees that got impacted by the pandemic, either at work or indirectly or through their families or otherwise. But nonetheless, we did have our share of employees that were affected by the pandemic. So we had to learn to be ready. We had to learn to have resources at the ready, and how we would shift from some of the things that we do. We have patrol, we have investigations, we have auto theft, we have all kinds of specialty services that we do here. and we had to basically develop a contingency that put those things in a batting order. If X goes away, then how does Y come in and fill that void? So that was one of the biggest lessons that for us. Fortunately, we were not hindered in any way that required us to trigger some of those plans into place. So thus far, we're managing, dealing with that planning, dealing with providing our employees the masks and the sanitizer and things like that, and then learning how to respond to places that may be COVID-19 places. So those are the ways that we were impacted by and still are. We've learned a lot in the last 6 months, and we're managing. I think a whole lot. I think we as a society are managing better today.
Yeah.
We know more, so therefore we are managing better. But I think that the whole crux of this for us was the contemplation that we may have resources that could be affected by this, and then contemplate how to still service the McAllen community should that happen in large scale.
Right. So we all saw how our healthcare provider, healthcare system and EMT services, for example, were really strained to the limit during the surge in cases and hospitalizations over some of the summer months. So did any of this affect police departments in any way? I mean, that surge, and if so, how?
You know, we obviously have been from the onset. We know what the data is showing us in terms of the demand for service. We saw it dip. We saw it go up. We saw when we were looking at daylight, basically at the end of May, we saw the skyrocketing numbers after that, and we saw the demand for service go up with that. So we're data driven, and we're monitoring that activity on a constant basis. So we have the advantage of being able to look at that on a daily basis and basically allocate our resources in accordance with the trends. So again, I say we at McAllen, we've been able to manage our resources. And you know, McAllen PD is it's the largest police force in South Texas. We've got a total of 450 employees approximately. At McAllen, the McAllen PD is the largest department at the city of McAllen. We account for about 25 to 28% of the entire McAllen workforce. So we're a very large department. We've got 300 officers that are authorized for us. So we have the capacity and we have the ability, and with proper planning, we've been able to meet all the demands through the highs and lows. We went through some highs. We can tell you exactly when those happened. And we went through some lows, and right now we're kind of looking at daylight, but then we're looking at perhaps opening schools and what that will have for us. We're also looking at the potentiality of vaccines becoming available, testing becoming more available. All of these things, I think all of us together as a society in the United States, we've come a long ways from day one. We've learned a lot from since day one. So at this point in time, I think we're all managing better. We know that we're looking at perhaps more testing and more rapid testing, which is a big thing for us. One of the critical points for us was being able to determine who needed to be tested, and then how quickly they could have results back. That was very critical for us. At McAllen, the city of McAllen, the mayor and our emergency management team was able to secure some services to enhance test results for us. In other words, what that meant for us is instead of waiting 7 or 8 days for a test result, getting that back to us within 24 to 48 hours. That was critical.
Do you have any kind of protocols in place where your personnel, your officers, for example, are getting tested on some regular basis, or are you mainly doing it when you have a reason to test them because there have been some kind of exposure? We've heard of some agencies where there's testing that is happening pretty regularly.
So most of the testing is pursuant to the tracing of a positive test. So most of the testing, that is required by us or that we necessarily send our employees to typically follows historical trace that they've been in contact with somebody
Right.
or otherwise. Now, every one of us has got our own personal and other private means of getting tested. We do some of that, and then we have the temperature screenings that we do as employees come into the building and things like that. So it's a combination of things. I think the fact that we've got more testing done today, the fact that results are quicker to get back to us, all that is helping us and alleviating the pressure that this pandemic has, not only on us, but departments like us, because police services don't go away. That's one of the critical things that I think the entirety of all of this has learned. Police services cannot go away, will not go away. The demand for service and the fact that life and property hang in the balance, that puts us at the very front end of all of this.
So, Chief, to kind of pivot a little bit, over the past several months, we all witnessed some back and forth between state and local levels of government, city and county levels, over the question of the extent to which mandates could be established, such as limitations on the sizes of gatherings, wearing masks, curfews, et cetera. And sometimes these back and forth caused some confusion among the general public as to what was enforceable, what wasn't. So can you help us understand some of those fundamental issues? For example, what kinds of mandates or ordinances are enforceable, which ones aren't? Or even if some are, there's some costs that go into it. I mean, I don't know if you could comment on that a little bit, because it was a bit confusing at times. Oh, now we have this order, so the police are going to be out there enforcing it. And then we heard, well, no, not necessarily. So can you just shed a little bit of light on that for us?
Yes, sir. Well, obviously, one of my primary tasks was to monitor, for example, let's say all the governor's orders and make sure that we understood those and that we had clarity to the best that we possibly could about those orders. And then that followed by, let's say, the county judge's orders, and then maybe followed by the mayor's orders in some cases as well. So it was critical for us every time these orders, and every time these orders came out, that we grabbed them down, we downloaded them, printed them, spread them out, and dissected them and understood them the very best way that we can. But once all that was done, we resort to basics. We are a law enforcement agency, and therefore we are government, and therefore, our actions are, as police officers, must be constitutional. So we resorted to basics, and whatever the conditions were, our basic approach to any of those things was that we must have, first and foremost, probable cause to make any approach, and then thereafter, if we discovered a violation of a curfew order, a violation of this, in the course of us doing our work in a constitutional way, then that would be fine. But and the distinction here is there's a difference between, let's say, an order that is anchored in the political arm of government, as opposed to let's say an order, how we carry that out at the law enforcement, basically administration point. One does not cancel the other for us in terms of the requirements that we must meet, and that is that every stop that we meet constitutional muster, that we have reason to believe or probable cause to make a stop of somebody, that an offense that's clear to us has happened, and then after that we could, it's the whole idea. If I make a bad stop, then anything after that is going to be basically a bad product. We resorted to basics. We still resort to basics, and that is, our officers, whatever stops they make, they must be lawful. They must meet constitutional muster, and after that, everything is game. If I stop somebody for going down the street because I saw that person run a stop sign, for example, but my reason and my lawfulness for that would be the fact that I've witnessed that person's run a stop sign, so I have a lawful authority to make that stop and temporarily detain that person. Now, once I've stopped that person, I found out he's wanted by another county, another agency. That's a secondary, but that must be followed by the first premise that the initial contact be lawful.
Yeah, I see. Chief, public health experts have been telling us that we will likely be dealing with the pandemic for some months to come, and there will likely be others in the future. So what do you think we need to do differently in order to be ready for these eventualities, especially from the perspective of public safety? And maybe if add on to that, was there, if you could grab the ear of our state legislators, and I'm sure you consult with them from time to time, or they call on you to get input, is there anything that they should consider when they are back in session this January from the perspective of your role and leading a police department?
Well, I do think that that this is an experience that we've not, may not have experienced in modern day United States of America, so to speak. Um, and by that I mean in perhaps 100 or maybe more years or so. So this is an experience that is new to us. And one of the things that that I think stands out for us is the fact that we have first responders, we have medical personnel that, even testing personnel. When some of us had to go to testing, we went into a room full of suspect COVID-19 cases, and we got a whole bunch of health workers in the middle of all that. Well, those health workers are basically in the ring of fire when they're working there. Medical personnel, our police officers, every time they make contact because a citizen called, or they make contact because they've seen a violation occur, they are in the high exposure area. So I think that I think that, again, this is a new experience for us. And I think we've got to recognize that our first responders in a given pandemic situation perhaps need special consideration legislatively, either for healthcare or compensation or otherwise, in those times when they are knowingly being exposed to a situation. We've got a variation of law enforcement teams that we deal with on a constant basis with the things that we do, and there's a difference between approaching a call because we went to and grandma calls and Johnny's not going to school. There's a difference between answering that call, and any one of those calls can turn, as we have learned over the summer, any one of those calls can turn really, really bad very, very quickly. But there's a difference between that call and sending a SWAT team into a known hostage situation with a known threat. That's the difference. And that's the distinction I'm making when we have a pandemic. What it is different when we have a pandemic because we are working in an environment with known variables. And I think from a legislative standpoint, I think that's one of the lessons that has to be worked on, and some considerations have to be built into for future first responders, for let's say health for them and their families, because they go home, or compensation, or any combination of things like that.
Yeah. Wow. Well, just the very fact that, your nature, you started off saying that policing has to continue. It's an essential service. It's not ever going to go away no matter what. So just the very fact that you're always out there and you have calls every 3 or 4 minutes, just the risk for added exposure is just always there.
Yes, sir.
So before we get to my last question, I did want to ask you a question. As you know, the census, which is a big concern with Futuro RGV right now, trying to get more, try to see what we can do to extend the date and so forth and so on. But we don't know where we're going to be when this episode airs. Right now we're a little bit up in the air. The census may go on a few more days into early October, maybe end of October. Just from your perspective, leading a large department, the police department and so forth here in McAllen, what does having a high census count, how does that impact public safety? How does that impact the police department? If you can just kind of help us get that message out, why it's important for people to do this.
Well, we are, for example, in the midst of a crisis now, and the federal resources that we're receiving or may receive at McAllen are all based on our census counts. That's so, a census count is critical to every community. We are in the middle of a census count now, whether it ends on October 5th in terms of self-response capacity, or whether it ends on October 31st in totality. Those are still up in the air, but we're working really, really hard to have a full and complete count at the city of McAllen. We've been working with Hidalgo County and other cities around us to get that done. You know, I can tell you that as of this morning, we're over 98% already done with regard to the count at McAllen, and that is the self-response count and the non-response count, all those combined. We're a little bit over 98% already. So we're doing really, really well in that area.
Wow.
But the count is critical. The count is critical to our community. It means that count is used to determine representation, for example. Congressional representation, congressional districts are going to be based upon that count. There are many public programs like education, after-school programs, library programs, you know, health programs that are based on the count when it comes to dividing federal funds for those. Infrastructure is critical for our city. If we want to prosper as a city, if we want to grow and create a better city for us and for those that follow us, you know, having the right infrastructure is important. In the area of infrastructure, highways and roadways are massive in terms of cost, and a lot of the federal share for those projects is based upon census count. So a census count is an all-around impact number for our communities. We're experiencing now some of those assets, some of those federal shares with regard to, let's say, COVID-19 with Hurricane Hannah. Every time something like that happens and they start trying to figure out what the relief may be for a community, it's going to be based on that census count. So it is critical for us to have a full count at the city of McAllen. Because the better we're counted there, the better from a resource standpoint that we're going to be at McAllen.
Yeah, you know, I've drawing from another field. What this is triggering in my mind is you hear in the healthcare area, you hear about the social determinants of health impacting health, and it sounds like you're saying besides however it may impact direct funding that's available for police departments through programs for them, just an overall investment in the community leads quality of life, and all of that, of course, triggers a more safe and environment for everybody. So I can see how it all fits together. So it's good that you're pointing that out.
You know, in a wrap up for that, very, very oftentimes, the degree of activity that, let's say, a policing agency has to deal with very often correlates with the socioeconomics of a construct of that community. So if from the macro scale, if that's what we're looking at right here, that's how ultimately the count affects the community.
Sure.
You know, the socio-economic construct of this community in the end results in a safer, better, healthier community.
Right. So, Chief, just to wrap up, take it perhaps on a bit more personal level, as you look back over these last 6 months or so through the pandemic, what would you say have been some of your biggest takeaways or learning experiences perhaps on a personal level? What have you learned or been reminded of in seeing how the residents of McAllen or the Valley have responded to this crisis?
You know, I have to say that, again, watching our personnel and knowing that our personnel continue to do their job in the face of these threats. It's not the first threat that we deal with. We over time have dealt with the HIV. We've dealt with bird flu. We've dealt with the swine flu. We deal with hepatitis. We deal with these threats on a constant basis. This one was different in that it was a mass scale, basically transparent threat to us that we could not see, we could not guard against, and we didn't. And in some cases, we did not know it was present. You know, some of these symptoms don't show up for a few days. So, looking at our personnel and watching them work was admirable. But then at the same time, knowing that they have to go home to their families and, perhaps risking their families as well, was probably the most honorable thing that we saw our personnel do on a day in and day out basis. So watching them work, and at McAllen, we've got some of the most dedicated personnel in the business of policing that we do in this part of the country. And I'm very proud of them. They've delivered service and they continue to deliver service today.
Great. Well, thank you so much, Chief. Thank you for taking the time to visit with us today. Nedra, I'll turn it back to you so we can wrap up.
Okay, thank you. And I want to thank you, moderator Felipe Salinas, for your good questions. And to you, Chief Victor, I always enjoy hearing your insights, and this conversation certainly was very insightful and very informative. And I really thank you for taking the time and sharing your wisdom with us. And then I have one more thing. Congratulations to our Chief Victor Rodriguez, Man of the Year for 2020 in McAllen. And I must say, I think it's very well deserved, Chief Victor, and we're very proud of you. Thank you for all you do.
Thank you
And
for your sentiments, and thank you for this morning. Okay, thank you so much.
okay, and with that, I will remind everybody that not only this interview with Chief Victor, but with many of our other Valley leaders, with their insights and their advice on how we're dealing with this COVID-19 pandemic, are on our Futuro RGV Facebook page and will continue to be shown throughout the fall and for the end of the year and probably into next year. So do check out the Facebook page periodically and see what our leaders are telling us. And with that, I will thank you once again, and till the next time.
Thank you so much. You all have a good day.
Thanks.
Okay.